Mic test 1 2. Mic test 1 2. You guys hear me? Okay.
There's some room on the other side too, sir. Okay. I don't want to. I think. Yeah. Okay. I hope that's going to be okay. I just wanted to, because, yeah. And then others, well, four to highlight.
Five more to sign. I have
Aloha, everyone. Welcome, and thank you for the gift of your time in joining us here today. In a few moments, we will witness Governor Josh Green sign several bills to improve access to health care and expand services for behavioral health care. Questions and answers will follow promptly after remarks conclude, and the formal bill signing will commence shortly thereafter. Without further ado, it is my privilege and honor to introduce Governor Josh Green.
Aloha. Great to see everyone. Thank you. We're going to celebrate collaboration today, and let me dive into a couple of talking points right off the bat. We have a few bullet points to share because there's a lot of bills being signed today. First of all, we're highlighting our work together. Thank you, Senate and House. Thank you, Healthcare Association. Hilton, gotta tell you guys how much I appreciate you. This is extraordinary legislation to actually help people. Let's hit the first slide here. Okay, so healthcare has evolved, and healthcare is not simply about having a doctor in the emergency department admitting someone to the hospital. Healthcare is about the wellness of society, the well-being of people often on the streets. How do they get the care that they need? How do we actually find a way in a civilized fashion to care for those who don't even have any chance to find their way back into a healthy state? And when you look at that triangle there, we call this social health. And social health, as you've seen us work on together, is about things like Alice families. You see Alice pop there. Well, because of the work of the Budget and Finance Group with the FIN Committee and WHAM Committee and all of our legislators, we're getting rid of some of the tax burden on Alice families so they can survive and afford health care. You also see a lot of other words in there like addiction. What happens when a person is addicted to methamphetamine and they have damage to their frontal lobe? Well, they can't find a way back into life. They can't come off the street. They won't even accept help. And so some of the bills I'm going to describe are meant to really look at this view of healthcare to get people well, to not just rely on the extraordinary work, which of course will always be necessary still when someone needs a surgery or someone has an infection. But there's a different kind of infection in society, and that is poverty and desperation. So that's what we're going to address here. Let's take a look at the next slide. So these are the bills that I'm going to highlight about 4 bills for you. There are more pieces of legislation which my excellent colleagues will probably reflect on also. First, Senate Bill 3139. What does this bill do? Well, it establishes emergency crisis intervention and diversion services programs. We've been working on this for some years, and as the good senator shared with me, back to when I was lucky enough to be in the Senate, talking about how diversion away from prison or diversion away from the emergency department may be more civilized and get people better care. And so what this bill does is it provides additional mental health care services and care to our homeless communities. We have created institutions to back this up. It replaces law enforcement with mental health and caseworkers in some cases. Many times law enforcement is not the right way for us to help people. We need them often when there's a crisis, but usually we need someone that can bring down the temperature, bring down the harm, what Core Services does, what Hawaii Harm Reduction Services do, and Heather's team. It redirects non-emergency cases into treatment solutions, so therefore improves our emergency care capacity. In the last few years, this last decade, as much as 30% of our emergency room visits ended up being individuals who are homeless with often very serious mental illness or addiction. The goal here is to have specialized services quickly available, and these are the crisis intervention services that are in the bill. So I'm super grateful to our Department of Health team who's agreed to work on these things, but really to the legislature who decided this has to happen. And we've had lots of conversations about it, but this bill is pretty firm. And no doubt it was made firm by Della Bellotti, because Rhodes is much too mellow and nice a guy to put such language in a bill. I tease, of course, there's an inner strength in both of them for fighting for this, and it's very important. So that's one bill. The behavioral health centers are important. If we don't have them, then this bill can't do anything. We created them, and we had to create extra capacity. So that was one bill. Now let's pop to the next one. Okay, The, is that right? 2159, thank you, yes. So it was funny because we had a meeting, guys came up and said, you're not going to veto this thing, right? And I said, no, this is like the best bill we've got. So here's what this bill does. It empowers the actual services that have to get done. This mandates and empowers our Attorney General's office to aid petitioners for assisted community treatment cases. A lot of times we even have the doctors, we can have guys like Misko and others, Dr. Ireland, who go and would deliver the services, but we can't find a legal way to help get people there. And I've had so many parents come up to me and say, please pass something to help get my child, who's 38 years old, off the street into care. I personally saw a patient on the curb one day who had been sitting for so long in one spot that she had developed first a decubitus ulcer near her hip, and then the ulcer broke away her tissue, and then I could actually see the acetabulum, or the femur bone there. I could see the bone while she was sitting there at the bus stop. And she had very advanced mental illness and was just not able to accept care, and we weren't able to give it. Yet I could see the bone coming through her tattered clothing, and then still couldn't get her help, in spite of all of our desires to help her. So now that removes several barriers to getting that person care. So there'll be some automated screening that will happen for ACT, assisted community treatment, and it authorizes our Hawaii courts to kind of intervene. And I'll tell you, this stuff is not easy. And if you want to know my opinion, it's that the ultimate civil right is to be able to be healthy and to receive services. And tragically, some people, because of circumstance, because of their illness, lose that capacity to even accept care. And so that's what this is about. So it definitely is critical. Let's acknowledge that a lot of our homeless individuals just need a hand. And if they can get well, there's new medications, or if they can even just get basic care through these kind of bills, everyone would be better off. And I care deeply about them. Okay, next slide. Okay, so now we turn to some additional legislation that was necessary. This is Senate Bill 3094. This is relating to peer support specialists. First, let me thank Donovan Dela Cruz for spearheading this and for fighting for this stuff. It is not easy to get extra positions when you're the administration and we're going through challenges and we're wrestling with resources, but we're working very hard with him and with all of our colleagues, especially health and judiciary folks and finance guys, to develop services so that we can do peer support and have an Office of Wellness, unlike any other state. And this bill appropriates 6 positions, $876,000 in our office. Eventually, these services will move to one of the departments. Right now, it's embedded with us. But this is Tia's baby. And somehow she has cast a spell on Donovan. And for all the best reasons, we are getting these appropriations. And it's just extraordinary. This really will help people in the context of a state that focuses on harm reduction after going through the harm of a tragedy like the Maui wildfire. It is very important. And embedding this in government takes us from where we are, which is the health state. We're the healthiest state. Everyone acknowledges that, to a place that can now really see new frontiers, which is wellness. People often comment whether it's, we hear this from the departments of public health statewide and nationally. People live longer here than anywhere else, but society has been reeling from some of these challenges, and we're cognizant of that. So we are deploying them, and it's just it's something special to behold. So we're taking ourselves probably 2 standard deviations, which is where we are now, above any other state for well-being, longevity, chronic illness. We have some work to do on health disparities, and we're taking it to the next level with these approaches. So that is something extraordinary. And then the last bill I'll talk about is HB 1827. So this bill is the vision, honestly, of guys like Hilton Rathel, our leadership at DOE, Keith, and others. In order to do these things that are described there, to have psychologists and psychiatrists and social workers, we have to train some of our young people. And the way to do that is to get them while they're young and get them to be interested in healthcare. Last year you saw us start the HELP program, which repays the debt for people who go into these healthcare disciplines, but we still actually have to train them. And to train them, it takes some resources. So you will see $3 million in new investments in Hawaii's healthcare workforce certificate program. It's a 3-to-1 match is there. $1 million to equip classrooms. This is just the beginning, but it's pretty special. And $2.8 million for a glide path to, quote, earn and learn in healthcare so that we can train more nurses, more social workers, more doctors over time. And I've got to tell you, when you add this to the loan forgiveness, the better reimbursements for Medicaid, and the capacity to care for high utilizers that have been on the streets for a long time, we're doing things that no one else has even dreamt of doing. So this package of 4 bills really, if people look at it closely, it should blow your minds, because other states are just trying to scramble to keep their hospitals open, and we are trying to deal with social health. So for that, I thank everybody. And last slide. Might just say mahalo. I don't even know. There you go. So mahalo from my heart for seeing some value in this process. We're going to sign these bills together, and we're going to hear from the stars that made these bills possible. Aloha.
Mahalo, Governor. At this time, I would like to introduce State Senator Sharon Mariwaki, Vice Chair of the Senate Committee on Ways and Means.
Aloha, and mahalo, Governor, for signing this really important bill, but also for your work as LG that started this whole process. So really appreciative that we're building on what really counts in terms of getting our homeless off the streets. This bill establishes the Crisis Intervention Center and Diversion Services Program. It's costly, but not as costly as the continual catch and release in the courts, or the countless emergency visits to our hospitals. Governor said 30%, yikes. This bill tackles the root of the problem for many homeless in crisis. First, a one-stop center for assessment, appropriate treatment or referral, and community connectors for persons in crisis. And third, a coordinated training program for these first responders. In 2021, the point-in-time count for Oahu was 4,448 persons. In January of this year is 4,494. It has increased slightly, but about 1%. We have done a lot, but we still have gaps. And SB 3139, as Governor says, attempts to address that. As background, my interest in continuing work on ending homelessness started in 2021 when I had almost daily calls on emergencies of e-messages complaining about the homeless encampments, assaults and thefts by homeless, outbursts disturbing the peace, fears to walk in the parks or on the streets. No more walking at night. It was overwhelming. What to do? I invited 14 leaders critical to achieving the goal of ending homelessness, moving homeless off the streets to a better place. They were committed and still are. In fact, we're going to meet next week. I want to just mention them because they were really, and they are extraordinary. They are the Honolulu Police Department, the prosecutor, the public defender, judiciary, public safety, now the Department of Corrections and Rehabilitation, and the Department of Law Enforcement, city and state homeless coordinators, and community agencies, IHS, Institute for Human Services, Hawaii Health and Harm Reduction Center, that's a long one, Harm Reduction Center, and Hina Mauka. The End Homeless Group, as we called ourselves, EHG, came up with 29 gaps in ending homelessness. For need for coordination among the state, the city, community agencies, for data on the homeless, and also the services that were available, housing, mental health, and substance abuse treatment. We tackled the coordination part by establishing in law what we now know as the Office of Homelessness and Housing Solutions. One major gap, a one-stop center, to help homeless in crisis with a warm hand up to be assessed timely and to place them in appropriate treatment instead of going to prison. But sometimes, of course, they do need to go to prison. But the Behavioral Health Crisis Center, a community one-stop center, is intended to do just that. It is also a great partnership between the city and the state and engages their departments to align services to help the person to safety and to a better life. It was to be a pilot, but I'm pleased that we now have an Iwilei Center that's real and permanent, that can prove effective in lowering the point-in-time count, and as importantly, demonstrate that homeless with mental illness or substance abuse problems can be treated and with proper support can live in permanent housing rather than on the streets. Another important component of this bill meets the need for appropriate connectors in the community. The first responders, they're the ones that are out in the street and they see people in crisis up close and personal. In 2021, when our EHG met, the homeless outreach agencies were already working with law enforcement. And I don't know if Major Lambert is here, but the training was as a crisis intervention team. Working side by side, these enforcement officers were being trained to work with community agencies. They were social workers in blue, so to speak. They really were assessing and saying this person really is a harm to self and others, and called upon the community agencies to assist. SB 3129 creates in law these crisis intervention enforcement officers and also mental health emergency workers, together a partnership to help those in crisis. And is just importantly, they put Department of Law Enforcement and the Department of Health working together to train these enforcement officers so they really do help people in crisis and get them to appropriate treatment. One area still needs refining, which I'm confident will be done after this bill is signed and we're in the interim, is to fine-tune the training of officers and their role in the field. For example, the bill requires a law enforcement officer facing a person who is endangering himself or others to call in to the mental health emergency worker. What if that worker is not available? What if it's too late, it's at midnight, and no one answers? That is a big gap. As our EHG learned, the homeless are not trusting of anyone. You need to be and make good on your promise almost immediately. At one of our meetings, the homeless coordinator received a call that the new woman who's running around the neighborhood is really finally willing to go to a shelter. So they called around. Everybody was scrambling, calling their agencies, trying to find a bed. And 30 minutes later, they said, we got one. Called back to the police officer who called. She was long gone. We found that the moment of clarity is no longer than 10 minutes. So you really need to be there and present. So I'm confident that the DOH, community homeless providers, the Department of Law Enforcement, and others will work out a better alignment so that we really are there and present when someone is in crisis needing help. So I'm pleased to have come this far with the collaboration, thank you, and of our enforcement and health departments. They're very important. SB 3139 starts the really big work yet to come, but I know that the homeless are going to be better served and those in crisis will be better served. Thank you. Aloha.
Mahalo, Senator Moriwaki. Now, please welcome Representative Gregor Ilagan, Vice Speaker of the House of Representatives.
Aloha. First, Gov, how do I put in my 120 pages of slide decks? Aloha, everyone. I am deeply honored to be here today for this significant bill signing ceremony addressing the mental and behavioral health challenges we face in our state. I want to start by extending my gratitude to Governor Josh Green, the Senate, particularly Senator Joyce San Buenaventura, our House members, as well as advocates and community members. Your unwavering support and hard work have been instrumental in the passage of these 4 important bills. SB 3139 is a groundbreaking measure that establishes a crisis intervention and diversion services program within the Hawaii Department of Health. This program aims to divert individuals experiencing mental health and substance use disorders from emergency rooms to appropriate care facilities by defining the role of mental health emergency workers and outlining the standards and procedures of their designation. This bill allows law enforcement to transport individuals to designated crisis centers. This approach provides timely, appropriate treatment and reduces the burden on emergency rooms. HB 2159 is another pivotal bill that strengthens our state's approach to mental health treatment. It facilitates assisted community treatment and involuntary hospitalization, ensuring that individuals in mental health crisis receive timely and appropriate care. By mandating the Department of the Attorney General to assist in preparing and filing petitions for treatment, this bill ensures that those who need help the most, including nonviolent offenders, are quickly and effectively supported. HB 2159 underscores our commitment to compassionate, community-based health care, improving public health outcomes, and alleviating the strain in our emergency services. SB 3094 represents a critical step toward enhancing mental health support in our state. This bill establishes the Peer Support Specialist Working Group within the Office of Wellness and Resiliency, focusing on creating a framework to license peer support specialists. These specialists play a crucial role in providing empathetic, informed support to individuals facing mental health challenges. By addressing the shortage of mental health providers and enhancing our support network, SB 3094 ensures we can offer better care and support to those who need it most. And finally, HB 1827 is a vital bill focusing on healthcare workforce development in our state. This bill appropriates funds to support the public high school healthcare workforce certificate program and the Glide Path program for certified nurse aides. By investing in these programs, we prepare our high school students for immediate entry into the health field and help certified nurse aides advance their careers while maintaining full-time jobs. This workforce development addresses the critical shortage of healthcare workers in Hawaii, ensuring better access to care for all residents. The passage of these bills marks a significant step forward. By addressing mental health crises and developing our healthcare workforce, we are making our state a better place for its residents and significantly improving Hawaii's mental health and healthcare workforce. Thank you.
Mahalo, Vice Speaker. Next, please welcome Hilton Rathel, President and CEO of the Healthcare Association of Hawaii.
Thank you for the opportunity to be here. There are 9 bills being signed today, as the Governor talked about, and they're all very, very worthy bills and all very, very necessary bills to, to support health and well-being in the state of Hawaii. The one that I want to talk about in particular is the one that was just referenced, HB 1827, that is about workforce. One of the realities we face in the state of Hawaii right now, it's not just about training workers, it's not just about recruiting workers, it's equally important to retain workers because we are losing workers every single day. And one of the things that this bill does, it not only does it help train people in our public high schools, it also provides career pathways for people to advance. It's one of the great things about healthcare is there's so many career opportunities. I would like to acknowledge a number of people today who have been so instrumental in this. Keith Hayashi and your team at the Department of Health, Department of Education, they are truly amazing partners. Thank you. I'd like to recognize both the House and the Senate. There is a number of different individuals, some of who are here today. Thank you for what you did to support this bill and to support workforce in Hawaii. I'd like to thank our membership who stood up and came to the hearings and argued so passionately for this bill. And lastly, I would like to thank our governor. The governor is a doctor, but that doesn't mean that he automatically is just going to go along with what we might want or what a hospital might want or a long-term care facility. But the governor recognizes the needs in this state, and he is a fierce advocate for health care in this state of Hawaii. I'm proud that we have him as a governor. Thank you so much, Governor, for all that you do. So thanks, everyone, for this bill.
Mahalo, Hilton. Up next, I would like to introduce Tia Hartsock, Director of the Office of Wellness and Resilience, as well as Kimi Takata, Forensic Peer Specialist with the Pu'a Foundation.
Aloha, mahalo for being here today. We're so excited to have two bills specifically relating to Office of Wellness and Resilience signed today, highlighting SB 3279. Big mahalo to the Senators Dela Cruz, Moriwaki, DeCoit, Hashimoto, and Kidani for introducing this bill, and for all the representatives and senators who also helped support and pass this bill out. Particularly wanting to highlight SB 3094 relating to peer support specialists. Very excited and with the work that has been done both in the nonprofits across the state and the Department of Health and Human Services within the peer support area. So we're excited to elevate this conversation and continue it across the state to implement more peer supports within our state departments and our communities. I'd like to turn it over to Kimi Takata, our Forensic Peer Support Coordinator with the Pu'a Foundation and the President of Pacific Peer Connection to speak a little bit about the importance of peer supports.
Aloha everyone, my name is Kimi Takata and I'm honored to stand here today as we take this important step towards making Hawaii a trauma-informed state. I work for the Pu'a Foundation as a forensic peer coordinator, supporting individuals navigating the criminal justice system. As a justice-involved woman, I can personally attest to the power of peer support. I'm also the president of Pacific Peer Connection, a new 501c3 nonprofit created by the Pu'a Foundation. As a peer-led, native-led, we focus on training peer supports specialists, providing peer support services, collaborating with employers, and advocating for peer support. Peer support is not just about empathy. It's about real, tangible benefits. It helps individuals heal, build resilience, and reintegrate into society as a stronger, more capable individual. Including voices with lived experience in shaping our systems fosters an environment of understanding and compassion. By investing in peer support, we're aiding personal healing journeys and creating a more effective and humane system for everyone. Thank you, Governor Green, for recognizing the importance of this bill. Let us work together for a brighter and more supportive Hawaii. Thank you.
Mahalo, Tia and Kimi. We will now take questions from the media, and here to facilitate that is Makana McClellan.
We'll invite the governor up to the podium, and first question comes from Lucas with Hawaii News Now.
I'd like to ask about one of the non-highlighted bills today, SB 3125. Could you explain the importance of expanding the right to consent to family planning and sexual health programs to minors in the state?
Sure. I was a family physician for several years on the Big Island and an ER doc for decades. A lot of times younger people get sick and they won't seek care at all if they don't have the capacity to ask for it. And then it can get very scary for them if they haven't gotten care. Disease can get worse. They can suffer greatly. And in this day and age, there's a lot of self-harm that goes along with illness and an inability to address it. We want wellness for people. We want people to actually get access to health care. This does that. 14-year-olds today, and I have a 14-year-old and a 17-year-old, are very different, perhaps, than they were 30 or 40 years ago. And they have to be able to navigate a very difficult world. In this case, I believe everyone deserves access to health care, without any exception. That's what that bill's about.
Media Q&A. I know. I'm gonna follow. Yeah, Pai Lima. We'll transfer. Erica will come up, and we're gonna move into the bill signing.
Okay. Yes. So I'm gonna sign the bills on this thing, so you can't see how bald I've become. And I invite anyone that would like to come up and be a part of these bill signings. Do a little. So, I wanted to just underscore a couple points that we were discussing beforehand. You heard us reiterate the value of these bills. It is not, a healthcare system is not something simple to run, and it's been years in the making. But we've now put together a kind of a comprehensive approach to healthcare, which I think is going to really, earn dividends for our people. And I'm glad that we had that question about, a law that would allow a 14 or a 15-year-old to access care if they had a bad infection, because if they get sicker and end up with a severe illness, they may end up in the hospital for weeks, months, or worse. And so all of these bills are meant to deal, like I said earlier, with the social health component of our system. And one part of the system doesn't succeed without care for the rest. So again, if we can't train young people like Keith and Hilton are encouraging us to do with the high school program, we don't have a healthcare system. If we don't have the access to actually get people into healthcare with their behavioral health challenges, they end up drifting in and out of incarceration or back into the ER. Costs a fortune, and they suffer. So that's what these are about. I hope that everyone really sees the bigger picture. So first bill I'm going to sign here is our 3139 relating to crisis services. Holler for this. This is probably one of the most important bills. Yes, we got here. So we got. Very cool.
Please call it out.
Okay. Oh, sorry. Sorry, you're so short, Noel. Thank you very much. Very cool. Okay, so the next bill that we'll sign, and as you heard, we signed a total, larger than these, just 4 bills, but these were the ones we're highlighting. This is the Mental Health Bill 2159, and this is for ACT. Critically important to society, and we'll continue to improve this until those who are all struggling on the street get care.
13 years in the making.
Thank you. Don't let him stab me with that. Okay, so the next bill, here we go, relating to peer specialists, very well described by Tia and friends. Again, our principles of a trauma-informed care system really take us to a new level. And I can tell you, I just spent 3 days with 8 other Democratic governors across the country. They would kill to have this kind of capacity to deliver health care beyond what the typical health care system can deliver. So this is just amazing. Okay, this is for you. Thank you very much. There we go. Don't be scared. Okay. And then, thank you. And then finally, relating to healthcare workforce development.
Superintendent next to the governor. Next to governor.
Superintendent. And so this is now law. And I just really want to say it really took a great collaboration between Healthcare Association and Keith. But Keith stole my pen, so I'm giving this one to you. Yes.
One hand.
Yep. These babies up.
Okay.
There we go.
You want to make sure you can see everyone's face? There it is. Thank you.
Yep, okay. 1, 2, 3. Let me check.
Anyone over here? 1, 2, 3. 1, 2, 3.
One more. People in the back can help you guys.
If you can't see her camera, she cannot see you.
Yeah, I'm so sorry. 1, 2, 3. There you go.
And just one last comment while I've got you, so it should be live. Just so everyone knows, we have 17 bills on the veto list, some for technical issues, but don't get all crazy. Not all those bills are going to get vetoed. We're working through some of those differences, and we have about 300 pieces of great legislation, so we're sorting little things out. But I know that there's a little bit of commentary going on, and I want people to be reassured we're going to make the most of this legislative session. It's really been incredible. Aloha.
Pause because we're going to do some photos. Who's calling out photos?
These are your glasses.
That's mine.
Not my glass.
Mine. I need these now.
Thanks, Governor.
Thank you.
Really appreciate it.